A lot of people who get diagnosed with fatty liver disease are often taken by surprise when they get the diagnosis, because they're like, but I didn't feel anything. Like, how could I have even known? Because I have absolutely no symptoms. And so today I am going to talk about the symptoms of fatty liver disease, or maybe the lack thereof, because in the early stages, or rather, well, for most of fatty liver disease, you're not going to have symptoms per se, specific symptoms to the fat in the liver. Symptoms arise when the liver starts to fail. So because there are specific associations with fatty liver disease, so basically fatty liver is associated with other medical conditions, and so that's kind of one of the ways, the number one ways to get an idea that, okay, the likelihood of fatty liver disease is, higher than I might have imagined. So in this talk, I'm going to talk about some of the associations with fatty liver disease, meaning if these things are present in your medical condition, then your chances of fatty liver disease are higher than average. Also, I will talk about some actual tests and also signs when things really get bad. So in terms of the associations, it's mainly the association with blood sugar abnormalities. So from pre-diabetes all the way to type 2 diabetes, okay? And the fact is that when you look at the numbers, just not even going through the cause, but just looking at the percentages with the association, people in the general population, this is just generally not necessarily targeting people who are pre-diabetic or diabetic. In the general population, it's felt that the prevalence of fatty liver disease is about 25%. So a quarter of the general population, certainly in developed countries, have the fatty liver. And of course, many of them do not. In fact, most people with fatty liver disease do not know, okay? When it comes to pre-diabetes now, depending on the study that you look at least 50% of people with pre-diabetes have fatty liver disease already. So if you are pre-diabetic, there's a 50-50 chance that you already have fatty liver disease. You already have a fatty liver, okay? Now that's pre-diabetes. If you are outright type 2 diabetic, then the chance of you having fatty liver disease is about 75%. So depending on the studies, it varies. Like, I saw one where it said about 54%. I saw one where they mentioned up to 80%, but give or take, 3/4 of people with type 2 diabetes are living with some amount of fatty liver. Of course, there are different degrees of fatty liver, but having a fatty liver is a big enough deal, okay? So any of these blood sugar conditions, pre-diabetes and type 2 diabetes, having those, you can pretty much get an idea that, I probably have fatty liver disease and I need to start acting accordingly, and maybe even, visit my doctor to find out, hey, like, how bad are things, okay? So those are the associations. How do you know if you have fatty liver disease? If you're pre-diabetic or if you have type 2 diabetes, chances are you very well have fatty liver disease, at least 50% chance, if not 75% for type 2 diabetics, right? Now, what is it like in terms of specific signs? So those are just associations, just the presence of a diagnosis. Now, what are some of the actual signs? So the specific physical signs, things that you can see, basically have to do with the presence of metabolic syndrome or insulin resistance. And I've spoken about those two things in previous videos. But essentially, metabolic syndrome or insulin resistance has to do with chronically high insulin levels, right? So because of the chronically high insulin levels, you have overstimulation of many different types of cells in the body, okay? And that's why you end up with things like skin tags, which are like bits of, flesh, or kind of almost warty, but it's not warts, but skin tags, bits of skin hanging from like the sides of the neck, the underarm areas, the upper inner arms as well, okay? Skin tags. And then there's acanthosis nigricans. That's another easy one to see, which is basically dark, sort of velvety patches, usually at the back of the neck, but you can have them in the underarms and basically in some areas of high friction, okay? So those are some of the commonest ones. Another sign is that's kind of associated with insulin resistance, something you can see for yourself, is having a relatively large belly, I guess you can say, compared to the hips. So the waist Just to keep it simple, if your waist is the same size as your hips or bigger, then the chances of insulin resistance are very high, and then by extension the chance of having a fatty liver is very high. So those three are just some simple signs. Just having any of those signs, just keeping it simple today, having any of those signs means that you probably have insulin resistance, and if you have insulin resistance, you probably have fatty liver. Okay, now moving on to specific number 3, specific blood tests. Now when you start getting blood test abnormalities, especially where the liver is concerned, then you really is starting to get some inflammation of the liver. So for fatty liver, it just starts with simple excess fat in the liver, but as that amount of fat increases, gets more and more and more, and takes over more of the liver, then the liver starts to struggle a bit, and there's inflammation. And as the inflammation continues and maybe even worsens, then you can have scarring in the liver, right, where normal liver tissue is replaced with fibrous tissue, scar tissue, right? And then when more of the liver is taken over by scar tissue and you have fewer working liver cells, then it means that you now start getting actual liver failure. Okay, and so there's a grade, right? Because liver failure is when you really start seeing, okay, there are liver problems. So the initial, when there's just malinflammation, there's like things like increase in the specific liver enzyme. It's ALT, just to keep it simple. So that enzyme might start to get a little high. It usually starts very mildly. It's just a mild elevation. In fact, that's sometimes how I've diagnosed some people with fatty liver. They have no symptoms whatsoever, and most of the tests are normal. They are not even diabetic, but you have mild increase in the liver enzyme ALT, and then you do an ultrasound, and then it shows fatty liver. Okay, other blood tests: high blood triglycerides, that's a type of bad cholesterol. Obviously, high blood sugar levels, blood glucose levels, and high hemoglobin A1C, which is that classic diabetes test that we do to check people's control of their diabetes, right? So those are some of the simple blood tests, keeping it very simple today, right? When you start now going to actual liver failure, so it's not just mild inflammation, but liver failure. Like when you Google on the internet, they're gonna say things like, oh, yellow, like jaundice and things like that. That's not what you would be concerned about, because by then you're totally sick, you're spending tons of time in the doctor's office. What you want to know is preliminarily the mild inflammation, the silent inflammation is going on. So when you start to get high blood pigment levels, bilirubin levels, and you're getting jaundice, and things are really bad, right? And when you really actually start getting liver failure, liver dysfunction, other than jaundice, you're gonna have other things like prominent blood vessels on the trunk, and then these like spidery vessels like on the upper shoulders, sometimes on the face. We call those spider nevi. Even like, again, when it starts to get really bad, you can accumulate fluid within the belly itself. So you have like your stomach just gets bigger and bigger and bigger. And then of course you can have swelling of your legs because of, the liver failing, and just general malaise and feeling sick. But by then it's going to be obvious, right? What you want to know is now in the mostly asymptomatic stage, which can be for decades before the liver actually starts failing, right? So yeah, liver failure, definitely want to do that. Another thing about fatty liver, the good thing about it is that if you really start trying to tackle it by, modifying your way of eating, modifying your diet, to where you're not really overloading your body with high concentrations of glucose, of sugar, right, repeatedly. So your body is not stressed with trying to metabolize that sugar or glucose. Because of sedentary living, most of that would get stored as fat, and you're having a fatty liver, so you don't need to be storing all this excess fat in the liver. So tackling fatty liver has to do with eating in a way, and just generally living in a way that you're not going to be every day continually storing more and more and more fat in the liver. Now, once you start eating in that way where you're not continually storing, then you're able to start burning fat, excess fat that's stored for times of need, and some of that fat, of course, would be that fat in your liver. So there is definitely hope, but just generally speaking, I think because of how common fatty liver is and how shocked most people who get diagnosed are, just I mentioned people getting diagnosed incidentally with a blood test, like a simple liver blood test, but a lot of people also incidentally get diagnosed when they have an ultrasound, an abdominal ultrasound for some other reason, and then there's an incidental finding of fat in the liver. So a lot of people find out like that. But a lot of people too, because it's asymptomatic, there are no symptoms, a lot of people would tend to kind of brush it off, forget about it, and then only when there is liver failure, yellowing, tiredness, swelling, all these problems, then, you know, they realize, oh my goodness, like this was really a big deal. So I hope you all found this helpful. And certainly if there is prediabetes, 50% chance of having fatty liver, because that's the association. If you're type 2 diabetic already, then it's up to 75% chance of having fatty liver disease. So just kind of pay attention to these things, evaluate your personal situation, and obviously, as usual, seek medical attention if there's any concern for anything related to your situation. If you all would like me to prepare a report to sort of show you several things you might be doing in your eating and lifestyle that are contributing to progression of fatty liver to liver failure, post it in the comments below and I will prepare that report and put it out to share and enlighten you all. Enjoy the last few days of 2022 if you're watching this video during the last week of 2022, and I will see you again in 2023. To your health. Bye bye.